Thank you for watching BeepMD. This is your front row seat to a doctor's drawing pad. These are real life situations and drawings that I make to make my patients understand their clinical situation, and these are the drawings that you get to see too. So don't forget to subscribe if you want to see more. So today we are going to talk about what we call is pleural effusion. Pleural effusion is nothing but a collection of fluid in the chest cavity, not inside the lungs, but between the lungs and the chest wall, the space between that. So let's understand it in the way of a drawing. So this is a human body. You could see the head and the chest. So this is what we call is a chest cavity. Now inside our chest cavity there is heart. There is this pipe which is known as a trachea or our windpipe. And then we have the lungs, which occupy most of the chest wall cavity space. So these lungs are occupying the space, and they basically like balloons, inflating and deflating as we breathe in and out. Now pleural effusion is nothing but collection of fluid. As you can see here, collection of fluid that happens between the lungs and the chest wall. As this fluid keeps on collecting, it becomes more of an issue. It starts pushing the lung up because the fluid is now taking the space. So what it is doing, it is pushing the lung up a little bit. And as this fluid keeps on collecting, it actually can collapse the lung. In that case, a person may have severe shortness of breath. So this is what is a pleural effusion. This is that collection of fluid between the lung and the chest wall that the doctors refer to as pleural effusion. And main symptoms of pleural effusion are breathing difficulty as well as chest pain, especially chest pain, which is a sharp stabbing pain on deep breathing or coughing. Now these could be general symptoms for other medical issues also, but again, these are the classic symptoms of pleural effusion. But just because you have any of these symptoms doesn't mean you have pleural effusion. It could be many other things, and that's why it is important to consult your doctor. So let's talk about the treatment. What do doctors do to get rid of this fluid? So there's a procedure they do that is called thoracentesis. Now thoracentesis can be of two types. One is diagnostic, in which the doctors would like to take just a little sample of it to find out why it happened in the first place. Or the second is therapeutic thoracentesis, in which the doctors would actually drain the whole fluid out to relieve the shortness of breath that is happening to the patient. So thoracentesis is a simple procedure in which there is a needle placed, and all the fluid then starts draining out of this needle into bottles. It could be a liter, it could be 2 liters of fluid, it could be half a liter of fluid, depending upon the amount of fluid. Now when all this fluid is gone, the lung expands back to its normal shape, and the fluid collected is then sent out for testing to find out what caused the pleural effusion, so we doctors can treat the underlying cause. We remove the needle, the hole heals by itself, there's usually no stitch required, and this is the treatment of pleural effusion. Again, thank you for watching, and do not forget to subscribe, because we are going to put out more videos giving you the front row seat to a doctor's drawing pad that is BeepMD. Thank you.